Under the banner, You Can Control Your Asthma, Antigua and Barbuda will join the rest of the world on Tuesday in celebration of World Asthma Day 2012. The Medical Benefits Scheme and the Asthma Awareness Group will place emphasis on educating individuals about the illness, controlling the chronic disease, and bring about greater cooperation between healthcare groups and healthcare educators. Azara Lavier reports.
The organizing group of the World Asthma Day 2012 awareness activities has already set out to meet its objectives. On Monday, the Foundation Mixed Crew received a visit from healthcare officials to bring about the awareness of the chronic illness. President of the Asthma Awareness Group, Julian Charles, explains that asthma is a chronic inflammatory condition affecting the airways or bronchial tubes that carry air to and from the lungs.
Asthma is a chronic disease. It's something that literally affects the way you breathe. If you can visualize breathing clearly, you know when you're breathing, everything's feeling normal. Imagine if I give you a straw and put it in your mouth and ask you to breathe through that straw alone. How much guys will enjoy breathing like that for the rest of the day? Anybody? That's how severe an asthmatic attack situation can be like for an individual associated with asthma.
Dr. Leslie Walwyn says people who are affected with asthma are sensitive to particular irritants such as allergens, exercise, pollen, strong fragrance, or even smoke. She says exposure to irritants causes the airways to become inflamed and constricted, thereby minimizing the quantity of air reaching the lungs.
When they're having an asthma attack, it's little things in the air that the body thinks. The body thinks that it's something terrible, and it closes up and tries to protect it from this little innocent thing in the air. So if we were in a building burning with fire, our air, we would cough, right? We'd have trouble breathing, we'd feel weak, and we'd collapse, because the lungs are trying to protect itself from all that smoke in the air. Similarly, someone with asthma, it's not something dangerous like shell tox or Bagan, which is harmful for all of us, or a building full of smoke, but it's little things like the hair on a dog or a cat's fur or a dog's fur. It's little things like the fuzzy toys that we might use. Okay, yes. Bad things like cigarette smoke.
The most common symptoms of asthma include breathlessness, coughing, tightness in the chest, and wheezing, particularly in the night or early in the day. When the symptoms worsen, the vital organs are denied their share of oxygen supply, and this leads to an asthma attack. Pharmacist Ivan Ambrose was also on hand and explains the various types of medications used to bring about immediate relief.
These are inhalers, okay? These are what are used to assist the person in breathing properly, okay? This one is the one that stops the asthma. So the patient has to be with this every day. Everywhere they go, they must have this with them, because you do not know when you're going to have an attack.
According to Global Initiative for Asthma, there are 4 key steps to controlling the condition: identify and avoid exposure to risk factors, diagnose and treat asthma, manage asthma complications, and develop patient-doctor relationship. Azara Lavier, ABS News.